the next segment of this evening's event, the College of Surgeons Lecture. This lectureship award is presented to exceptional individuals who make significant contributions to the advancement of surgery in Singapore. This evening, our lecturer is Professor Lee Man Kay, Senior Consultant, Urology Center, Raffles Hospital, and Executive Director, Urology Association of Asia. He will deliver his lecture titled Reflections in Transplant Surgery. Before that, I would like to invite Dr. Edmund Cheong, Honorary Treasurer, College of Surgeons Singapore, to read the citation on our 18th College of Surgeons lecturer. Dr. Cheong, please.
Professor Lau Ching Hock, College of Surgeons Guest of Honor, Dr. Sophia Chew, Assistant Master, Academy of Medicine Singapore, Dr. Matthew Yeo, President, College of Surgeons Singapore, Council members, distinguished guests, and fellow academicians, good evening. It is my distinct honor and pleasure to present the citation for this year's distinguished College of Surgeons lecturer, Professor Lee Man Kay. Now, Professor Lee graduated from the University of Hong Kong in 1975 and received his surgical training at the University Surgical Department in Queen Mary Hospital, as well as at the Department of Urology at the University of South Manchester in the United Kingdom. He obtained his Fellowship of Royal College of Surgeons in Ireland and Royal College of Physicians and Surgeons of Glasgow in 1980, the Fellowship of American College of Surgeons in Urology in 1986, and the Fellowship of the Academy of Medicine Singapore in Urology in 1990. Now, in 1986, he was appointed Chief of the Division of Urology and Kidney Transplant at the Department of Surgery, University of Hong Kong. 2 years later, he accepted an invitation to Singapore to join the newly established Urology Department at Singapore General Hospital. Now, over the next decade, he played a pivotal role in advancing the department, incorporating state-of-the-art technologies such as extracorporeal shockwave lithotripsy for urinary stones, microwave thermotherapy for benign prostatic conditions, and routine ultrasound use in outpatient care. And he became the inaugural director of the Urology Center at SGH. In 1998, Professor Lee embarked on the next phase of his career by leading the Division of Urology at the University Department of Surgery, National University Hospital, and National University of Singapore. Under his visionary leadership, the NUH Urology Center was launched in 2000, and by 2002, he had successfully established the second full-fledged Department of Urology in Singapore, serving as its founding head of department. His leadership also guided the development of urological services in Alexandra Hospital. A distinguished academic surgeon, Professor Lee had secured significant research funding, authored many peer-reviewed publications, served on editorial boards, and been invited to speak at major regional and international scientific meetings. After an illustrious public sector career, he entered private practice in 2003, while continuing to serve as visiting consultant to multiple public hospitals. His expertise has also been sought across Asia, and in 2014, he was appointed visiting professor at the Department of Surgery, the Chinese University of Hong Kong. Professor Lee's contribution to urology and kidney transplant in Singapore are nothing short of extraordinary. Renowned for his exceptional clinical judgment and surgical mastery, he is known in the operating theatre as Xiao Li Fei Dao, or rather the pugilistic master with a flying knife, whose flying knife precision, speed, and accuracy strike decisively at cancers and stones alike. He is particularly recognized for tackling highly complex cases, including kidney cancers with IVC thrombosis extending into the cardiac atrium, performed without cardiopulmonary bypass, publishing what remains to be one of the largest of such series in this domain from this part of the world. He's also known for complex kidney transplants, intricate urinary reconstructions, and exceptionally broad repertoire of urological surgery. Professor Lee is widely relied upon as the go-to or rescue surgeon for the most challenging and seemingly impossible cases, both in the public and private sectors. Another defining hallmark of Professor Lee is his unwavering commitment to teaching and mentorship. He has always believed in pushing younger urologists to reach greater heights and has personally trained and mentored several generations of local and international urologists. To many, he's simply and respectfully Shifu Master. Professor Lee's contributions to the Singapore Urological Association have been remarkable. Across 28 years, he served in numerous capacities, including over a decade on the executive committee beginning in 1990, as well as being president of the society in 1919 to 2001. Since 2003, he has been a member of the Board of Trustees, serving as chair from 2021 to 2024. Professor Lee has always viewed the SUA as a professional brotherhood and has contributed generously to its continued strength and unity. In recognition of his devotion, he was conferred the SUA Lifetime Achievement Award in 2022. Now, Professor Lee has also made profound contributions to regional and international urology. He served on the board of directors of the Society International de Urology from 2000 to 2004, was president of his Congress in 2000. His invaluable contributions to regional urology was recognized by the conferment of honorary memberships by the Malaysian Urological Association and the Thai Urological Association. Now, Professor Lee has also contributed immensely to the development of the Urological Association of Asia, which has currently grown to be one of the largest urological societies globally. By serving in its executive committee since 2011, as president from 2016 to 2017, as organizing chair of 2 international UAA meetings, and as honorary executive director of the association since 2018. In 2019, he was conferred the UAA Honorary Member Award, the highest distinction granted by the association. Professor Lee's stewardship of Singapore's National Kidney Transplant Program has likewise been exceptional. As head of the MOH renal transplant team from 1996 to 2003, he unified transplant surgeons across all public hospitals, thereby strengthening training, ensuring continuity of the roster service on disease transplant, and expansion of living donation. In 1996, he received a HNDP award to study non-heart-beating donors and perfusion preservation in Japan, work that laid the foundation for today's MOH-supported DCD donation initiatives at NUH, TTSH, SGH, and the perfusion pump acquisition. He organized and integrated organ retrievals with the liver and heart teams, following the change of HOTA from only kidneys to include liver and heart. This process has since become regular practice in multi-organ retrievals for disease organ donation. In 2002, he introduced laparoscopic hand-assisted donor nephrectomy at SGH and NUH, paving the way for minimally invasive kidney donation to reduce the disincentives for living organ donation. He was a member of the MOH Transplant Advisory Committee from 1996 to 2014 and received a Long Service Gold Award from MOH in SG50. A founding and life member of the Society of Transplantation Singapore, he was honored with his Lifetime Achievement Award in 2022. His influence extends well beyond Singapore. Notably, he played a pivotal role in training his clinical fellow and was instrumental in establishing a kidney transplant service as well as percutaneous nephrolithotomy surgery in Nepal. Today, he remains active as chairman of the Solid Organ Transplant Group at Parkway Hospitals. Beyond his professional excellence, Professor Lee is well known for his remarkable athleticism and belief in the importance of health and fitness. A former marathoner and triathlete, he remains an avid cyclist, conquering challenging hills and mountains with grit and determination. He's a man of many passions: singing, golf, fast cars, and motorcycles. But above all, he's committed to a life of balance and service. His involvement in medical missions, including one to a Nepalese village at the epicenter of an earthquake, exemplifies his compassion and willingness to go above and beyond for others. Professor Lee's quiet, humble leadership naturally brings people together, whether mentoring trainees or organizing weekly NUH runs that bridge disciplines and roles. He fosters unity and camaraderie wherever he goes. Widely known as a perfect gentleman and an all-rounder, he is admired for his integrity, generosity, and ability to connect with people from all walks of life. Professor Lee is unquestionably a giant in the fields of urology and renal transplantation. His contributions have shaped the landscape of urological care in Singapore and throughout the region. It is our privilege to hear from him this evening, and with the deepest respect and admiration, I now invite Professor Lee Man Kay to deliver the College of Surgeons lecture. Thank you.
Only this way the cursor will show, so you actually go down. Okay. Okay.
Here. Okay. Good evening. Thank you, Edmund, for a very comprehensive and long citation. Dr. Sophia Chiu, Matthew Yo, dear surgeons, urologists, my family, cycling friends, ladies and gentlemen, it is really a great honor to be here to give you the talk, and I've been hearing that, I just can't wait to hear your talk. But anyway, my acknowledgements to my mentors that include Dr. Leong Chi Hong, is in Hong Kong, Kiji Fu, Walter Tan, who have always been supporting, and team members that would include Sally Kong, Chris Cheng, Consi, Edmund, and Ho Yi. They have been supporting the transplant program for as long as I've been working for the last 30 years in kidney transplant here. So from the day when I graduated in 1975, I just went back for a class reunion, 50 years. I was quite emotional, but very innovative in a way. But with the last 50 years, I can give you 3 points that we can share. First, as stated, to be a surgeon is hard work. So there were lots of thoughts whether I should carry on. There were frustrations, there were failures, there were times that you were feeling very weak. So you need lasting motivations, and you need to learn to be humble, helpful, and adaptable to many, many situations. The second point that I would like to bring up to share will be when you are the leader, so after your training, 10, 15 years, now it's time for you to have a team. But it is important that you have to bring every team member to new heights and advance together. And if you are together, you are stronger. If you are alone, you don't. The third thing is the transplantation. From all the work that I had with kidney transplant and organization of the multi-organ transplant team, it is teamwork. So And the surgery itself is very demanding. A lot of people will say, oh, you just join three things together. But the fact is, you cannot afford failures. And if you don't want failures, you have to be very meticulous. So these are the points that I will elaborate later on. So this is the hospital, Queen Mary Hospital, which was the only university hospital and the only tertiary center in Hong Kong. And I worked there from day to night, alternate days on call, 150 admissions a day, followed by another full day of assisting Professor Ong, who would scream and shout and nod my head and whatever you can say. It was hard, very hard. But I learned. If you look at this, when I finished my training and I was the head of the urology in Hong Kong, I was able to detach this part of the stomach and put it down into the bladder. This was done in the 60s and 70s for tuberculosis of the bladder. We don't see it now, but I have done a handful of these operations. You can see the IVU, which also we don't do IVU anymore. The left kidney is missing, and the bladder looks very, very strange. But this is the best for bladder replacement, especially when you have a young patient. So I moved to greener pastures with my motivation and my adaptability, and therefore I moved and I still carry on learning, and I learned a lot of new things over the years that I've been in Singapore, and improving my surgical skills, work hard to seek new grounds, and a lot of times we never, or I would recommend it, you don't ever count on compensation if you are given extra work. So when I came was 1988, end of 1988, but then the time, a year before, the law of Human Organ Transplant Act was enacted, and this, as you all know, is applicable for accidents, 21, 60 years old, only Singaporeans and permanent residents, and this was the very world-famous opting out system. So at the beginning, we have the first generation of kidney transplant surgeons, Professor K.T. Chan, Abu Raf, Fu Ming Chong, K.T. Fu, Professor Lau, and Jing Hong Ji were working very hard to keep the program going. And in those days, I must stress the point that we had to carry the harvested kidneys in the back of our car and drive it down either to SGH or NUH for the recipients. There was no support for anything else. We just have to carry it. So I came in and I was asked to organize the team. I was given a good opportunity. I spoke to Dr. Kwa Sung Bee in those days, and then we organized a transplant roster with case presentations, selection of perfusion solutions, organization of multi-organ retrievals. All the programs were gradually set in since 1990. And so with the advisory committee in transplantation, we have in fact set up and agreed training, or the minimum training for training of a transplant surgeon. So you must be able to finish 10 retrievals, 20 recipient surgeries as an assistant, and then you need to be supervised to do your own retrievals and your own recipients until the seniors find that, okay, you are able to be on your own. Then you will be able to be gazetted as a kidney transplant surgeon. So this was our workload. Initially, we were putting in every year 1999 to 2003 in the initial days. So you can see the numbers here. Myself, Chris, Michael, David Consigliere, and the rest. And the assistants were Lê Quát, Ye Hong, Kok Bin, and the rest. Then came 2004. So this was the year that we have included heart, liver, and corneas, and include all causes of death. So we had another task to carry on. So in 2004, we have the gazetted number of surgeons. You see this list of 14 kidney transplant surgeons. In fact, I didn't show in this slide. The next page would be the heart transplant surgeons. YP was included as the heart transplant surgeon, plus the liver surgeons also. And we need to keep a logbook, and with a minimum of 3 a year. So the transplant team, or at least the kidney transplant team, was very open to a logbook system, which the rest of the academy were quite against in those days. Well, we look at Singapore Halter program. These are the list of things that we have to follow, which is in fact an independent unit which consists of training, doing publicity education, presenting the results, and do strategic planning. Further developments in the transplant program were taken, and we started looking at marginal donors because the numbers were not good enough. Marginal donors were people who were a little bit older, so we were trying to do explant biopsies, and non-heart beating donors, as well as management of multi-organ teams. And we also tried to look at smaller hospitals, whether they were able to support multi-organ donors in the middle of the night, should there be a suitable donor in a small hospital. One of the things that we have discussed was to use a single solution for all the organs, because at one time we had 3 different types of solutions. We have UW solutions, you have Eurocollins. So it was very chaotic. But we have finally come to one solution, and that is the HTK. If you're looking at this cadaveric program statistics, so it started from 1988, and we were doing about 20, 30 a year. And the orange segment is, in fact, the MTA means those are people who sign in and not the Halter patients. So in a way, the Halter patients were quite constant in a way that you will have about 15, 20 a year until there was 0 in 2003. Now in 2004, yes, we changed, and you can see the pattern has completely changed. There are a lot of people donors that belong to the Halter system. So, to explore further, to encourage more transplants, we have started a program called Hand Assisted, and it is a bridge, in fact, from open surgery into minimally invasive surgery, and that did very, very well. And we had, in fact, the ministry's approval that in 2004 that there's no more reporting required to the ministry, and is regarded as a standard procedure for laparoscopic hand-assisted donor nephrectomy. And well, the next year we had a big tragedy. A patient died, a donor died in the afternoon, the day that she donated the kidney to her husband. Then, of course, it created a lot of problems, and we went to the High Court. And the family was suing me, David Consulary, and NUH. We have found that there were only 1,600 mils. The plaintiff lawyer put up as res ipsa liquidator, which I don't really know how to pronounce it, but it means somebody is dead, somebody is responsible. Well, this, in fact, this incident, we defended successfully, thanks to our law minister who was working with us as the defense team lawyer. But for this, we have changed two practice of living donor management. One is we are not allowed just to put 2 hemalogs to the renal artery. And then the next thing is we have to observe the donor for 24 hours in the ICU continuously post-operatively. So this has changed the practice in Singapore. So for hemalogs, the manufacturer is Telefax. Quickly put up a paper before our trial. I think they're trying to escape from any legal problems. So they were saying 2 hemalogs is contraindicated in donor nephrectomy. So we explore newer grounds, trying to keep our donors safe, and that is not just with 2 hemalogs. We can put extra titanium clip, and we also try to do transfixion techniques using an additional suture, which would be the safest and will have no chance that it would slip. Well, I also have a set of slides which I probably will not trouble you too much, because this is in fact a training set of slides for the transplant surgeons doing how to do bench surgery to fit sizes, and also for the fact that we have been seeing quite a lot of lymphocytes in the past, but with this method that I have been telling everybody to follow, we do not touch the lymphatics, and since then we have never encountered any more lymphocyte when we preserve the lymphatics. Anastomosis, of course, quite standard, and making sure that the kidney can sit well, comfortably, without kinking and twisting, and close knit to make sure there is no stenosis. And we also use intraoperative Doppler, pump up blood pressure, make sure the kidney is not so cold, and make sure that the kidney has good perfusion before we close. And anything in doubt should be rectified before we close the patient. And further development on the hand-assisted donor, now we have in fact moved to a pure laparoscopic nephrectomy. And in fact, this should be the new standard, and it has a lot of advantages because it causes less pain, shorten the convalescence, improve the cosmetic outcome, and remove the disincentives inherent to open donation because of scarring and fear of pain. Well, my Cantonese is as good as our Manpower Minister, Tan Si Ling. So I give you one sentence in Cantonese. 你知道錯呢，就要改，你改呢，就會做得好。So I must say we were taught to be humble and serve. So we put the team together and move everybody together, and we will prosper. So it is a very constructive and rewarding 50 years of my journey with lots of pains, but a lot of gains. Thank you for your presence, especially my family and friends. I wish everybody good health and peace of mind and go home happily. Thank you very much.